Oh, yeah, absolutely. So there were definitely a few recurring themes that we noticed. And what I want to call out here is that the providers that were interviewed for this had experience in treating both in person and virtually. So this wasn't just their virtual perspective, but it was kind of the comparison. Um, and access to care was one of those themes. I think that's the thing that we think most about when we think about virtual care, which is the ability to get in for an appointment sooner than you would in person, or to see someone if you didn't have someone in your area. And in fact, in another paper that we just published, we found that 40% of origin patients faced significant barriers to accessing care. So this is a real problem. And then we knew that cost was the number one barrier. And then just time and lack of other nearby options were also very high. Coming back to some of those themes that we were talking about, psychological safety was another one, which I've kind of hit on here a little bit, but patients may feel intimidated to going to an in-person provider, or like there's some sort of a stigma associated with going into the clinic. So having control over the setting is very meaningful for them. Another theme was that, and this is going to sound kind of technical, but that the care was clinician guided with a patient executed care focus. So this is meaning that the provider is guiding education, assessment, and movement, requiring some autonomy on the part of the patient to execute the plan. So essentially, virtual providers can't rely on their hands to do the work. You have to do it when you're on the other side of the screen. And that inherently kind of gets you to understand what you're doing faster and helps you to rely on yourself a little bit more quickly. Again, we don't know this for sure. We would have to do a self-efficacy study to know that, but these are just some of the themes that came out. Another was the fact that the care was delivered in their own environment and in real time assessment of the symptoms in the context in which they occur. So this kind of cuts down on that translation between what's happening at home and in the clinic, because if someone's telling you when they go to bend down to lift their toddler, and you can actually see them bend down and lift their toddler, and then they feel that heaviness or that prolapse symptom, you can see exactly what they're doing and then help talk them through how they would modify that lift, or how they're holding their child, or how they're bringing it to their chest, and how to brace the abdominals and how to breathe. That would help to reduce those symptoms. And we can try that with a weight in the office, or if they happen to bring their kid into the office, but it's just not the same as when it's in their own environment. And then for those pregnant and postpartum patients specifically, this is a really powerful mode, because it's not just about how you lift your toddler, it's about how you're feeding your child, it's how you're getting up off of the floor, it's how you're moving through your own space. So it's just removing some of those practical barriers and avoiding unnecessary travel or the physical demands of getting to the clinic, finding childcare, or just trying to recover. So it's just kind of keeping the barriers lower when you've got a newborn in tow.